Arthritis at the base of the thumb is a very common disorder where the joint between the thumb metacarpal and the wrist bone becomes arthritic or wears away. A lot of people don't know what arthritis is. Arthritis is a wearing of the joint. Typically, our joint surface is lined by cartilage and is perfectly smooth. When we move our joints, we don't feel them or notice them because of that joint surface being smooth. As we all age, to a certain degree, that cartilage will wear. And I kind of give the analogy of potholes in the road or having an uneven surface. And as that worsens, those uneven surfaces will rub up against each other, become painful and inflamed, and that's what an arthritic joint is. The pain is usually with gripping, grasping, trying to open things, really anything where your thumb opposes or grips something and that force is loaded at the tip of the thumb will create more pain at the base of the thumb. Arthritis at the base of the thumb is fairly common. There is a genetic predisposition, so a lot of times you'll notice that a family member has it or maybe that your mother had it, and as you're aging you'll notice that pain at the base of the thumb becomes more noticeable. A traumatic event, whether you had an injury or a fracture, can predispose you to developing arthritis at the base of the thumb, as well as things like rheumatoid arthritis, gout, can also create an inflammatory change creating arthritis. Treatment options for arthritis at the base of the thumb include anti-inflammatory medications. You can also use a brace. A brace can be very cumbersome to use because it limits motion, but it also is very effective in limiting the amount of inflammation at the joint, creating less pain. The other options include in the office we can provide a steroid injection which will take away inflammation. It does not cure arthritis, it doesn't make the joint abnormalities go away, but it can make your pain come down quite a bit and can be a good, safe, temporary measure. The surgery for basilar thumb arthritis is called a CMC arthroplasty. It's designed to take a section of cartilage and bone away from the joint, to decompress the joint so the two bones are not rubbing up against each other. We borrow a portion of tendon, weave it into the joint to create a cushion or support for the thumb. This eliminates the arthritis, allows you to pinch, grip, and grasp without the abnormal joint rubbing up against each other. The recovery on surgery, it's an outpatient procedure. You go home that day, it takes less than an hour to perform. You're in a removable splint for the first 4 to 6 weeks. After that, you're working on motion and therapy, and then slowly graduated to working on strengthening. At about 3 to 6 months after surgery, you have no restrictions. Everybody does heal a little bit different rate, so we have to tailor that to each patient's needs. If you are experiencing any of these symptoms and are concerned about this, please contact your medical provider for further care.